We're told that they're offering us a clean CR. First of all, yes, it reads like clean CRs I've voted on and voted in favor of before, but there are two issues. But they basically, we're sending a clean CR to a president with dirty hands. So first, they refuse to put in a provision that prohibits, clearly and with teeth, impoundment of the funds that we send. And second, they refuse to put in a provision preventing rescission. So what does this mean? It means we're supposed to pass a continuing resolution to provide funds for all of the functions of government, including ones that they support far more than we do. And then the president is free to defund whatever priorities he doesn't want, or to send to the Congress a rescission of any provisions. So instead of us agreeing that we continue government funding at the same level, they've got two mechanisms to defund Democratic priorities while funding Republican priorities. We're told that they'll negotiate on health care just as soon as we pass their bill. They wouldn't negotiate on health care in January. They knew in February that these credits were going to be abolished and 22 million Americans were going to face massive increase in their premiums. They knew that in March when they wouldn't negotiate. They knew that in April when they wouldn't negotiate. And come July, they said, you know, not only won't we negotiate regarding the people who are going to lose their Obamacare subsidies that are necessary because otherwise their premiums double, we're going to take health care away from people on Medicaid. So they won't negotiate with us for all these months. Now we're supposed to give them what they want, and then they're going to negotiate? I don't think so. Fool me once, shame on me. Shame on you. Fool me twice, shame. Now, we have seen what happens when federal employees don't get paid. Burbank Airport lost air traffic controllers, a major airport close to my district. Massive delays. Why? Because some air traffic controllers decided to call in sick, as we're seeing that across the country. Now, the National Association of Air Traffic Controllers has urged their people to show up unless they are physically sick. But I have a difficult time telling people, we're not paying you, but you show up for work. Now, why are we here? Why are we even talking about a continuing resolution? That's not the way to run government. There are 12 appropriations bills that should have passed the House of Representatives in the spring, maybe the early summer. And they should all have become law months before September 30th, because the people that run the government should have known months before their year began on October 1st what their budget was. Well, have Republicans who control both houses of Congress passed these 12 appropriations bills that function different parts of government? Not a single one. They haven't done their job, not in January, not in February, not in March, not in April and May. They have only 3 of those bills have passed the House, and none have passed, and of those 3, none were supported by the Senate. So why is Congress shut down? You know, the last time we had a major major shutdown, it was when Congress was not scheduled to be in session. It was Christmas. But the time before that, Congress was open. We have to be open. If any federal employee is essential, Congress is essential because we're the only ones that can open the government back up. So what we were doing in 2013 when we had a shutdown, we had hearings on FEMA. I represent the Palisades. Those were important hearings. We had hearings scheduled today before Judiciary. to deal with the Epstein files. No wonder Congress is shut down. We can't open up the government till we bring Congress back into session. Now, there is an issue where Democrats are divided. Some believe that all the Republicans have been sent home because maybe some of them would talk to us about health care, and their leadership doesn't want to do anything on health care. Another chunk of Democrats believe that they sent everybody home so that we wouldn't talk about the Epstein files and we wouldn't swear in Ms. Grijalva, who will then sign the discharge petition and force a vote on the Epstein files. I think both Democratic groups are right. They don't want to talk about health care, and they certainly don't want to talk about Epstein. So Democrats need to fight for those millions who are losing their health care, including, and I have the statistics for California, but I've gone on too long, and I bet you my colleagues from California will bring those statistics up. But millions of Californians are losing their health care because Republicans wouldn't negotiate in January, they wouldn't negotiate in the spring, and they won't negotiate now. And I yield back.
Thank you.